Hello, everybody. Good to see y'all tonight. Thank you for joining us for Tuesday Talk. We have a special conversation tonight, and we felt like this conversation was truly important because there are so many times as women where we go to the doctors and we make our checkups, and we are in that phase where we're trying to have children, or even after we're having children, after we're done having children. There's so many times where we have these questions, we have pains, we have aches, we have different issues going on. And I've heard so many stories of women who have not been able to get the answers that they need, haven't been able to get the help that they need. And so we really wanted to come on and have this conversation. As you all know, I experienced four miscarriages. And on that journey, I think I went through about four doctors because there was just so many different things that I was running up against. Uh, One doctor didn't believe that I'd had a miscarriage. There was another time where things weren't told to me after I got some blood work tests. So this is just one of those things where I just felt like it was important to talk about this thing. And I know that at They That Wait, we're constantly pouring into our spirits and we're trying to encourage. But the Bible says that I wish that you would prosper in your health, even as your soul prospers. And so, as much as we want to pour into our souls and encourage you spiritually, we know that there are physical things that we're facing as women. And we want to empower you to ask the right questions when you go to the doctor, to know what you should be looking when you are seeking out your primary care physician and even your gynecologist or OBGYN. And so we just wanted to bring this topic to light today so that we can talk candidly about the things that we need to know. And I am by my co-host. You all have seen her um, several times. Let's see, let's get her in here. Hey, Sherelle.
Hey.
Hey, girl.
Good evening, everyone.
Yes, good to
I'm
have you
excited.
here.
Yeah.
Yeah, every second Tuesday, you all see Sherelle, and we usually have testimonies about miscarriage and fertility. And so tonight, we wanted to bring this topic to light because this is something we talk about a lot within Psalm 139 Ministries, They That Wait Ministries. We really want to pour into our ladies. And so I'm glad to have her here. And then we have another guest, Dr. Quantrilla Ard.
Hello, hello, everyone.
Hey, hey,
Happy to
girl.
be here.
Hey.
What's up?
Good to have you here. Tell
Thank
us a little
you.
bit about yourself, Kwani.
Oh my goodness. Well, I'll give you the short version.
Okay.
My family and I just relocated to Atlanta from Maryland, and we are here. My husband is in healthcare, so he is now working at Morehouse School of Medicine as their PA associate director and academic director. So that was a great full circle moment for us because I actually got my master's in public health from Morehouse School of Medicine. And after that, I continued on to receive a PhD in health psychology. And that I did my dissertation on how racism affects Black and African American women and negative birth outcomes. So that's
Mm,
a little bit about what I do.
awesome. It's
Good.
so
Yeah,
good to have you here. We've been
thank
excitedly
you.
talking about this moment
Yeah.
to have you here. And now that you are officially Doc,
Official.
All right.
it worked out perfectly.
Yes.
And last but not least, we have Dr. Gina Wilson. Hello, welcome. Tell us about yourself, Dr. Gina.
Hello. Well, thank you, Gianna, for having me and putting me in a punishment for making me talk about myself. I hate that part, but I will do my best. I am Gina Wilson. I'm a board certified OBGYN physician, and I've been in practice and specializing in women's health for about 19 years now. I've had a great opportunity to take care of so many women in different aspects of their life. I've also had the opportunity to see areas where, as healthcare providers, we can improve for all women and, of course, women of color. And so I still do some clinical care. I've had the opportunity to do some non-clinical care and really focus as a patient safety advocate and a health literacy advocate. And I am really excited about tonight's conversation.
Yes. And also, Sherelle, for those who have not, this may be their first night watching, can you tell us about yourself and your platform for women who are dealing with infertility?
Okay. So my day job, I work at the National Children's Advocacy Center as a victim advocacy trainer and family advocate, working with children who've been abused. And on the side, I am a blogger. The name of my blog is She Experienced, and that's just where I share a lot of my life experiences. And more recently, my infertility journey is what I share. So through blog posts and through my YouTube channel, that is where I have been sharing my journey and connecting with other women and really just talking about, this fertility thing. It's just since I'm going through it, like I just feel like I got to talk about it. So that is what I do.
Awesome. Thank you so much. So, again, the reason we felt this conversation was important is because we all are involved. You all are involved in some way with ministering to the women in Psalm 139 Ministries. And there were just so many stories of people saying, well, I was having this pain. I went to the doctor. I was, maybe 20s. And they told me that I needed to just have a total hysterectomy. I wasn't married. I didn't have children. I've had women say, I went to the doctor and I told them that I was in pain. They didn't believe me, or that, just all of these different things. And we thought it was important because we've had Dr. Gina Wilson on before to just kind of help us get the questions in arm. But I thought that it would be great to do this as a panel discussion. And so we just want to jump right in with the questions to both of you, Dr. Art and Dr. Gina. Can you all tell us what are some of the disparities that we are seeing as it relates to Black women and their maternal health or even their reproductive health? Because I know that this extends beyond having children. Like there are certain stories that we're hearing about, unnecessary surgeries and different things like that. So what kind of disparities are you all seeing?
Well, you hit the nail right on the head. A lot of unnecessary cesarean sections. One in particular instance that I can remember, the March of Dimes also had a kind of a panel like this. And one of the participants was talking about how, as Black women, we experience a higher rate of unnecessary cesareans because of long held prejudice about our bodies as Black women. And I knew this to be true personally because I've had 3 C-sections. And the first one was obviously necessary. I had preeclampsia, so they had to deliver my son immediately. But the second and the third one, now I'm starting to wonder, were those really medically necessary? The second time I was told that my pelvic space was too narrow to push my son out. And I'm thinking, oh, well, he's the doctor, so he should know. But after listening and years of research, now I'm like, well, our bodies are designed to get these babies out. You know what I mean?
Wow.
And it makes me wonder, had I not been a Black woman, would I have been allowed to have a VBAC? So that's definitely one area that I'm seeing some disparity in.
What are you seeing, Dr. Wilson?
So I have to apologize. I lost audio right before Dr. Connie started speaking. So do you mind repeating the question?
Yeah, no problem. What kind of disparities are you seeing between, with Black women's health and reproductive and maternal health?
Quite a few, and now I see what she was just talking about. Uh, One probably that's the most common that you're seeing more in the news is probably pain management, the disparity in pain management. There have been beliefs that Black and brown patients, women of color, have a higher tolerance of pain. And I think that that comes from a long line. I think everybody thinks it's new. When I was early in my career, I actually thought that it was because we were so stoic. We had learned, I guess, when we were growing up with our mama or daddy or grandmama, big mama give us a whipping, and she'd be like, stop crying or I'll give you something to cry about. So you learn how to just kind of hold it in. So I said, well, maybe we're just so stoic, but that's not the case at all. It's a long history, and I won't get too much into it, but I know that you all may be aware of the father of gynecology, Dr. Marion Sims, operated specifically on slaves without anesthesia because of the understanding that we didn't feel pain. We didn't feel the same kind of pain. It is unfortunate that there have been recent studies within the last couple of years, and I believe they just published another one, where there are still healthcare providers that still think that same thing, that we have a different tolerance for pain. So I would have to say, as far as racial disparities, that's one of the more common that we see, especially in labor and delivery. Who gets the epidural first? Who do they say, oh, you're okay? That's something I've seen a lot, unfortunately.
So true.
I'm glad that you brought that up.
If I could just add on to what Dr. Kwani said.
Go ahead.
Yeah.
Go ahead, Cheryl.
Oh, okay. I was gonna say that I'm glad that you brought up the pain, that issue, because I've experienced that myself and didn't realize anything about it. I just, it's my doctor, so I'm gonna listen to them. But I remember even from a young age having terrible menstrual cramps, like terrible. And to the point where I would have to stay home from school, or I would, be throwing up, or it was just really bad. And a lot of the times I was told that it was normal. I was, prescribed birth control pills, to help with the side effects of that, And even more recently, when I first went to a fertility specialist, when we were, told that we were going to have difficulties conceiving, and I told the doctor about my history of menstrual cramps and that sort of thing, and he thought that I might have endometriosis, but I remember his words were, your pain doesn't sound significant enough to do anything. And I just thought like, oh, okay, well, maybe it's not. But then it wasn't until I went to another doctor and he's like, no, that's not normal. Like, you shouldn't be in that much pain. Like, that's not normal. So when I first, started hearing or doing more research, and then I saw that they were encouraging more women to advocate for themselves. So what does it mean to advocate for yourself, and why is that important? And that's for both of you. Sorry.
All right.
Okay. Go ahead.
Having a voice is super important, mainly because, society really is highlighting the fact that voices of color, and especially women of color, their voices have been silenced and hushed for far too long. And, it's not a coincidence that hashtag, raising awareness for Black women's voices or amplifying Black voices is a trending hashtag. It's not, because we've been traditionally just kind of pushed into silence. And then also some of that is because we don't want to be seen as the stereotypical angry Black woman. We silence ourselves and we censor ourselves as well. So it's important to speak up, because people can't read your mind, right? So if you don't tell them something's wrong, they surely may not ask you if something's wrong. So you have to speak up, just to put it out there, to say, hey, this hurts, or this doesn't feel right, or, something's not right. And it's important for you as an individual, but it's important for other Black women who will either come behind you in that space. Now you're starting to set societal norms and standards that Black women are no longer going to be silent. So that's one of the reasons why I think it's very important to advocate for yourself.
Thank you.
I definitely agree with what you're saying. Yeah, I definitely agree with what Dr. Kwani's saying. You don't want to be invisible, and unfortunately, historically, and this is not with just healthcare. We can be invisible, not seen. Some of us even have been taught to, like you said, let's conform so that we don't rustle up too much. So, being heard is important. It's important for advocacy. And I think self-advocacy is important because in the absence, it increases your risk for adverse health events. If you're not your own advocate, that means you're not your own protector. You're not your own champion. You're not your own investor.
That's good.
What do I mean by that? Investing in your health, investing in what you need to do to stay healthy, protecting your time and your stress. All of those things are, they all contribute to a person's well-being. And researching, understanding what's going on with the medication. I always tell people, I'm like, if information is given to you by a healthcare provider with no explanation, then we haven't done our job. If medication is given to you without no education, then we have no job.
Wow.
We haven't done our job. If you've had a surgery and you have a complication and you were not aware of it, we haven't done our job.
That's
and
good.
I want to say this at the healthcare provider too. None of us have gone into training to say, I am going to work to actively hurt someone. And that's with any of the providers. There are implicit bias, but none of them actively go in. Most do not go in. We take the Hippocratic Oath, do no harm. But for whatever reason, things can be missed. It could be time. It could be implicit bias. It could be anything. And that's where that self-advocacy comes in play. Your doctor gives you a diagnosis. They walk out the room and you're just like, I just heard Charlie Brown's mother. I don't know what just happened. But a person who believes in self-advocacy would say, wait, Dr. Gina, what harm?
Yeah.
Right.
Bring it back.
Yeah.
I get it. I think it's really important and well known.
I'm so glad you said that, Dr. Gina, because you have personally helped me in this area. As you know, I have hit you up several times, like, I'm experiencing this. And you're like, did you go to the doctor? And I'm like, well, no. And so then 2 weeks later, I'll get another text. Have you gone to the doctor yet? And I'm like, yeah, I'm making that appointment now. And then after, she will follow up and she will say, well, and I'll tell her, I'm better. They gave me what was the name of the medication? And what you need to ask this, you need to ask that. And I'm just like, I wasn't paying attention enough. And I think a lot of times when we do have a hospital visit or an ER situation and we come out of there, I would call her and she'd be like, well, what did they say? What's the name of the condition? What's the name of the visit? And I'll be like, I don't know. They said I'd be all right. So, but she taught me that I need to write everything down, that I need to be asking questions because she's going to ask me. And even now that it comes to my children have had some bouts in the ER and I've had to hit her up a couple times. And she was like, go out in the hallway, find the doctor. You need to have the answers to these questions. Like the fact that you don't know this and you've been in the hospital with your child for 4 days is a problem. Like, we need to get deeper. Let's find out what the issue is. And so she has really helped me in that area of advocacy to ask questions and to really dig deep into what is going on and let's rule out all of these other things. And So it's helped me because sometimes we are shy and we don't want to ruffle feathers and we don't want people to feel like, why are you
Right.
questioning me? I'm a doctor. But she has helped me get over all of that.
I want to ask why that is. Why are we afraid to ask the questions? Like, we'll be quick to, at least for me, I'll be quick to leave an appointment and then go to Google. Like, why not just ask the doctor? Like, why are we afraid to ask those questions? Like, why?
That's a good question.
I think that's just the culture that we've been in, you know, like this is the doctor. And what did the doctor say? Take 2 aspirins and go to bed. Okay, well, they did all the training. They're smarter than me. They must be right. And then, you know, that's been like that all of our lives, all of our parents' lives, you know, and it's just trickles down. And not just doctors, but I guess, unfortunately, any person that would be of some sort of authority. We're seeing now across the board, not just in health, that it's important to question people. I talk about a story all the time. Back in the day, before most people, I guess, I don't know, before y'all, I don't know how long ago, but back in the day, there used to be a lot more plane crashes than ever before. Like now, to hear of a plane crash, you know, that's just like, wow, what in the world happened? There were so many plane crashes, but the airline industry recognized that hierarchy piece, that piece where the flight attendant was too afraid to ask the pilot a question was an issue. And it's just a culture. So I think it's, I think it's a culture that we've grown up in, but we recognize, and I think hopefully everybody in the call recognize that it's okay to question. It is okay to say, what did you mean by that? Because I have to go home and live with this new diagnosis.
Right.
You get to go home and eat dinner with your family. I need to understand.
That's good.
Somebody asked the question and said, fibroids seem to be common among African American women. Why is a hysterectomy always the preferred method among doctors, especially when the pain seems unbearable? And a lot of people are chiming in saying they had fibroids. Dr. Gina, can you speak to that?
Unfortunately, I can. How can I say this? Because this is on stream and it can be replayed. So I think one of the things that you know, I'm going to just have to be transparent, and there have been healthcare providers overall that when providing information as far as treatment to patients, they usually give them the option that they know most likely will have definitive treatment, like you'll be done, you'll never have pain, you'll never have any problems at all, versus other options. I think that is important for us as healthcare providers to give the options of management of fibroids, regardless of what the person's success would be. For example, if I had patients that had fibroids, I would go through all of the options because I thought that they needed to know. And I would say, this is an option. You're more likely to come back in 3 months, but it is an option because in the end, it is your choice. Every healthcare provider does not do that because sometimes I think they just want to say, hey, you know, we do a hysterectomy, we'll be done. And in the South, you know, you see it a lot. We used to say in the South as providers, if you saw a woman over her 40s with a hysterectomy, it's because she had not been to the doctor yet. I mean, she still has her uterus. She has not been to the doctor because they took them out very quickly. I have to be honest, I gave so many options to my patients. When it came to me taking my boards, they asked me, why do you have such a low hysterectomy number? And I was just like, because I gave them their options and they chose things outside of hysterectomy. So what does that mean for patients? And we keep going back to the same self-advocacy. Ask what your options are. I recently wanted to make a financial change, and I called the finance advisor, and I did research before, and I said, what are my options? And he gave me those most common option that would have the biggest risk for me, the most fees. And I said, what are my other options? And he kept saying, well, this is your option. And I said, well, what about X? And he was just like, well, you can do that. And
Wow.
sometimes as patients, we have to do that for a healthcare provider and say, okay, well, what about X? I saw this on Google. So yeah, it is unfortunate. It is seen a lot. There definitely are other options though.
And sometimes it's almost a
Specifically for
blessing.
fibroids.
Okay. Sometimes it's almost a blessing that we have Google. I have one person on here saying, this is real. My neurologist prescribed me medication that would prevent me from ever being able to give birth. I was never informed of this risk and I didn't ask questions, but something just told me to Google the medication and she found out.
Wow.
Like I'm a huge proponent of informed consent. And as a researcher, like this is literally the most crucial part of research is informed consent. And Dr. Gina was talking about health literacy. It's also a huge part of health literacy. You can't make a good decision until you have all your options.
Yeah.
And not giving someone all of their options is really robbing them of their reproductive justice. You have to give people options. You have to give them just lay it all out there and then give them the choice. You know, give your recommendations, but also give the options. And that is also a part of being able to advocate for yourself. You can't advocate for yourself if you don't have all the information.
Yeah.
So for young people who are maybe teenagers or, you know, just starting in this journey and they're maybe not at that point of reproduction, but they are going to their annual visits and they are, you know, getting older, what kind of questions should they be asking their GYN at this point so that they can be aware of what, you know, what lies ahead?
Well, goodness. So here's maybe something that's unorthodox or maybe non-traditional. My mother was the one that took me to my first gynecological appointment. And, you know, well, she was an RN. So of course she's in the health field. So, so that probably was why she chose to do that. But she wanted to normalize this for me. She wanted me to have this relationship with this person who was going to be intimately, you know, we're going to be intimate here because we're doing all this. But she normalized that behavior for me and she made it comfortable for me to ask questions about, you know, my physiology and my reproductive health. And she asked me to come up with a list of things to ask the doctor. And of course, that was a little, you know, a little scary at that age, but it helped me to think through, even as early as, you know, 17, 18 years old, what am I feeling? You know, what is going on in my body? She was teaching me to listen to my body and to advocate for myself, even at that age. So, that's I mean, something even as simple as just asking your teenage daughter, does she have any questions about her body? Maybe she's not comfortable asking you, but she can write down a list of things to ask the doctor when you take them. So,
yeah. And even maybe starting younger, you know, asking our little girls. Yeah. Somebody said.
So I definitely agree with you, Dr. Kwani. I think it's really. So I agree with you. I think I'm going to ask that question, answer that question, Gianna, because it's staring me in the face. I can't not answer. But I just want to say, but when young women go to gynecologists early, I think you're right. It's important to just know what is normal. What am I supposed to feel? What is just considered normal? Breast, abdominal pain, menstrual cycle, what's normal? So then when abnormal shows up, they understand what's going on. And believe it or not, there are a lot of schools now, a lot of places that are not really dealing with basic health. I had a patient that came in a very young patient one time that came in and she was distraught because she could not get pregnant. And she knew that her boyfriend could get her pregnant because he got another girl across the street pregnant. So as we dealt with that issue first, then I talked to her about just basic things. And I asked her, let's talk about ovulation. What happens every month? An egg comes out of the ovary, and what happens next? Her answer was, it hatches. So I said, okay, let's start with the basics. And I think those basics are important. I do want to address a question that just popped up. I don't know if this is one you were going to ask, and this is from says sometimes we don't know what to ask.
Yeah.
And some good healthcare providers that have the time will recognize that. I've actually counseled patients, looked at them, and they gave me the nod. But I'm looking at their eyes and it's deer's caught in headlights. So I'll say, you know what? Do you have any questions? They say no. So then I say, well, I'm going to give you a pop quiz. And I start asking about what I just, counseled them on. And it's usually for the younger patients.
Yeah.
But it's helpful because it helps me to understand, was I talking at a level that they understood? Did I break it down to them? But everybody doesn't always have that time. So I have to say, for people who think they don't know what to ask, think about the 5 whys that you learned when you were in school. What, why, when, where, how, what do I have? Why do I have it? When do you think I got it? Where can it be treated? How can it be treated? Those are just basic questions. You can just start with those 5 whys. And that will actually facilitate more conversation, discussion with you and your healthcare provider. You can start there.
Yeah, that's good.
There was a question that just popped up, but it went away. I want to try to pull that one back up.
There it is.
There it is. Yep, that one is good. As a person who has fired thousands of doctors, I wish more women knew that they can push back and ask questions. What are the easiest signs that a provider will not have your best interests at heart? Wow.
I'm just going to go and start with the very,
First, I'm
very
scared of that person.
I know. Don't be scared. Don't be scared.
Yeah.
For me, the first sign that a provider doesn't have your interest at heart is if you're talking and they cut you off.
Wow.
If they're asking you questions and you're supposed to respond to those questions and they're cutting you off, that's a red flag. Because no healthy communication and dialogue can happen when you're not allowed to actually answer questions that they're asking. So that's definitely one thing. And listen to your body. If you kind of have some bad vibes, you know what I mean? And, we're not trying to go all the way left here, but a lot of times you can kind of pick up on what somebody's putting out there, their mannerisms, and these are very small, but kind of intuitive things that you can pick up on before you get to like the huge red flags.
Yeah.
So, yeah. And that's from a patient perspective. So
that's good.
Yeah.
No, that's good.
No, but that's definitely true. I tell people all the time. I remember I wrote a blog post about it. How to choose your own doctor. If the person, your healthcare provider is dismissive, if they don't ever seem to have time with you, and they don't supplement that appointment with something else, they're not explaining things to you. Those. I guess any sign that you would have if you were in a bad relationship would be the same if that provider was not a provider.
That's right.
If you hear other people in the community complaining about them, if
you
hear the nursing staff, if maybe even the nursing staff aren't what you expect. And it's interesting because I'm seeing a couple of questions. One that said that they had a GYN that was dismissive when they gave alternative suggestions. There is no time requirement that exists or is written anywhere that says you have to stay with a particular doctor for a certain amount of time. Usually within a visit or two, you know that doctor is not for you.
Mm-hmm.
I
And
agree.
it doesn't necessarily mean that they're a bad doctor. It means you all don't have a connection.
Yeah.
And if you don't have a
Mm.
connection,
Woo,
you need to
that's
go to
good.
someone who does. It's
That-
Wow.
unfortunate the way we do, we choose our doctors now. I think we do more research trying to purchase a car
Mhm.
Mm.
or
Mm.
a new
Wow.
home than we do someone who is over our health care and keeping us alive. And
Woo.
trust me, if you got in a car, you test
Mm.
drove, and you're just like, oh, I don't want this car, you wouldn't buy it. It's the
Wow.
same
Mhm.
thing as any healthcare provider. If it doesn't work for you, go to the next person.
Mhm.
Mm.
I agree.
And also, you want someone who makes you feel more than just a patient. You know, the current
Mhm.
doctor that I have, the fact that at every appointment he asks me how I'm feeling. Like the first appointment, he's like, "How are you
Mm.
feeling?" I'm like, "What?"
Mm.
You know, the fact that he asks that,
Yeah.
and takes the time to talk to me and my husband as more than just patients, but he actually shows that he cares. Like that is what you want to feel. You know what I
Yeah.
mean? And that also kind of goes into my next question.
Mhm.
Because I speak highly of the doctor that I see, and I have a friend who doesn't have access to the type of care that we receive here. So the next question is for those who may live in a small town or who don't have access to a good professional or a good medical professional, what would be your
Mm.
advice?
Mm. Ooh.
Yeah, I
Yeah.
wanted to piggyback on that question because I was talking to my mom about this discussion, and she was just saying, I knew I was in a bad situation. I knew that the doctor didn't have my best interests at heart. I knew I was in a situation where it was a race issue with her
Yeah.
doctor, but
Mm.
she lived in a tiny town, Selma, Alabama, and Birmingham, and all those other towns were too far. Everybody was like, "There's a great one here, over there," but it was like when you're pregnant, it's like, okay, we got to drive all that way. And so she was kind of mentioning that, you know, that small town issue of not having access, and what do you do?
I'm gonna let Dr. Gina start with this one, and
Yeah,
then
that's actually a
I'll
really
give
tough
my
question.
I'll give mine after.
So that is actually a tough question.
Yeah.
And I actually had that particular experience when I was covering a hospital at a critical access hospital. It was on the coast, on the West Coast. The closest doctors, closest hospitals were like 2 hours away. We were separated by
Wow.
a mountain that could have landslides all the time. So pretty much,
Mm.
whoever was on call, that's who you got. One of the things that I know that they did is that there was a type of joint caring with hospitals, with the healthcare systems at the bigger cities, so that we would take care of some of the little things like their weekly or monthly visits. But they did either calls with the nurses or the midwives. They did telehealth. A lot of times those small places don't have those providers at all at those hospitals. So they do a lot of video conferences, video health. I think patients don't know that it exists. And it's important to ask, call those places in those bigger cities and say, hey, is there a way where you can take care of me, but I can still, get whatever little care, like my vital signs and things like that at the hospital near me? Can you all co-manage? There are more hospitals that are doing it pre-COVID. Now that COVID hit, and hospitals, clinics, doctors are having to figure out how to get to their patient, they're way more open to doing video conferences, telephone. I know of someone personally who was having to drive 2 hours away to see a doctor,
Wow.
and she hated that drive. COVID hit, and then she was getting that telephone call, and she loved it. And a lot of times, if there's after that one visit, a lot of things can be taken care of over the phone. Some things is hands-on, but a lot can be taken care of on the phone and video conferences. So that's one thing that they can consider.
Yeah. And I just wanted to suggest, don't be afraid to expand your team of medical professionals and your birth community. Traditionally, we have gone to, physicians and hospitals and, those types of settings, primary care settings, but you have a whole community of birth workers, midwives, doulas, who have been trained to do this, to help women bring their babies into the world. So don't be afraid to expand outside the traditional methods of, getting health seeking behavior. So I just wanted to put that in there too, especially for areas that are smaller. You will probably end up going to a birth care center before you will go to a hospital. So definitely take advantage of those birth workers.
That's good.
Yeah, that's awesome. We did have one question that popped up. Why is it so hard for health providers to treat PCOS? The common answer is eat better, lose weight, but it's not always that simple. Can either of you speak to that?
Yeah, PCOS, the polycystic ovarian syndrome, is a really complex disease in itself. And the management should be, the person has to be treated. Let me say, if I have patient A and patient B, I have to tailor treatments very specific to those different people. There's many ways to treat PCOS. So there is a basic understanding of PCOS where estrogen is basically stored in our fat cells. Okay. And if we have too much of us, then that means we have more estrogen. So once the body is just like, well, there's too much estrogen, let me flip and turn into an androgen or a testosterone. That is why doctors or nurse practitioners will say, well, just lose the weight. And you'll be fine. I think as healthcare providers, we have to do better by recognizing that saying lose weight, stop smoking, get more sleep, reduce your stress is not as helpful without giving some sort of path or guideline to do so. And even maybe treatment in the meantime. And just out of transparency, that's usually what happens with PCOS. And honestly, we're trained to diagnose, we're trained to treat, we're trained to do surgery. We are not always trained to manage social issues or stress issues or nutrition issues. So if a person has PCOS and they have a healthcare provider say, well, it will be so much easier if you just lose weight, then the next question you should ask is, how do you expect for me to do that? And if you can't tell me, who can you send me to that will help me with that process?
That's
right.
And that way, you can get what you need.
That is good.
I mean, it's
Follow up
true. I tell people you have to ask for what you want. Don't be shy. Don't worry about people thinking you're mean. Well-behaved women rarely make history.
Come on, say it.
Come on now.
From what? And if you're that direct with a physician, then or your nurse practitioner, then it might even trigger and say, oh yeah, maybe I should send you to a nutritionist. Maybe I should send you to a health trainer. Maybe I should give you this prescription because you send it to your insurance and your insurance will pay for your Weight Watchers for free. Those are options and things out there. Just asking those questions will help that process.
Yeah.
Come on, Dr. Gina, show us how to clap back with it. How you expect me to do that?
Yes.
I love that.
Yeah.
That's good.
She had a follow-up question.
But I think it's,
No, go ahead.
Go ahead.
Well, I was going to say, I think women in general, women of color, we are so used to fighting for others, for our spouses, for our nieces, nephews, husbands. For whatever reason, we don't always do it for
That's
ourselves.
true.
And that's a culture that has to change.
That is true.
And we hear it all the time when you're on the airplane, you know, when it starts going down and those oxygen masks come down, you hear the directions. It says, put yours on first,
Yeah.
then help the person beside you. And somehow we have gotten away from that.
Yeah.
Or we never actually did, you know, because of our history. So that's something that we have to do is be our own advocate.
Yeah.
Okay, I'm done.
No, this is good. It's important to have these conversations. You know, I am 34. Yeah, I'm 34 and I'm just now, you know, hearing this stuff and getting these questions. So hopefully this can help someone who's even younger and can know, like, let me start asking these questions. Like there's an app, I can't even think of the name of it. Where you can type in questions that you can ask your doctor, and you can also record your session. So if you go in for an appointment, you hit record and it records everything, and then it creates a little transcript at the end. I'm gonna find it and I'm gonna say it.
I love that. That's good.
I'm gonna let y'all know.
Yes, that's another thing Dr. Gina has always told me. You need to be recording this stuff so you can go back and look at it. And I'm like, oh, yeah, I'm about to do that. Especially when it comes to myself, like you said, I do it with the kids. I'm taking notes, but with me, I'm like, oh, I'm fine. Okay, thank you. You know, where do I pick up my meds? I'm good. But then it's like, no, we got to put that mask on ourselves. We got to take care of ourselves and be informed. And I'm so glad you mentioned nutrition, wellness, and how that ties into our overall well-being. I remember last year, I changed the way I was eating. And so I'm just like, man, we're losing weight. We're eating healthier. This should be great. But all of a sudden, I started having these horribly heavy cycles. I started having horrible cramps. I started having like low iron, fainting spells, just the whole nine. And I'm thinking, I've changed my diet. What's going on? And so, like most of us do, I start texting my girlfriends. I text Kwani. I was like, girl, have you ever had... I texted my cousins, because we always go to our friends before we go to the doctor, right? As women, we're like, girl, have you ever had anything? You ever felt a lump or blah. Like, we just got to run it by our girls. And so I'm so glad that I have a community of people who are like, you need to go to the doctor. And it's funny because I would ask them, well, did you go? Because a lot of them said, I'm having the same thing. Wow. And I was like, did you go? Well, no, girl, but you need to go. Right. But I ended up going to the doctor, and I remember him going through all of the different, I felt impressed to go to my primary care physician. And I remember him going through all the questions. Do you have fibroids? Do you have cysts? Do you have this? And I'm like, no, I've not had any issues. Like, this just happened in January. And of course, at that time, I'm just like, I'm healthy. Like, this is really baffling. So literally, we're going through all the scenarios, and he's like, I really don't understand why this is happening. And finally, he said, you know what? When you changed your diet, were you starting to eat a lot of soy? And I was like, yeah. I started eating a lot of soy. With every meal, I'm eating veggie meat and soy milk and all of these things. And he was like, that will do it. That, you know, our bodies see that soy as estrogen, and it's pumping all this stuff, and it's making your period, you know, just go to hyper. And he was just like, you need to cut out your soy. And I was so, not cut it out totally, but just cut back on it. And when I say immediately, I noticed a difference with my next cycle just by cutting back on the soy intake. Wow. And I had so many friends, even my mom, I was talking to her. She's like, man, I wish I had known that I had the same symptoms, same exact thing. And they did a hysterectomy because they were like, well, you're having heavy periods. Let's just cut it all out. And she's like, man, I was consuming a lot of soy at that point. What would have happened if we had explored the nutrition and kept doing it? And I remember my doctor, even after he said and asked about the soy, he told me, he said, flesh and blood didn't reveal that. Like, that was God. And so I just wanted to put that plug in there, because our nutrition does truly have our our whole being has an
Mm-hmm.
effect on our body. And having a praying doctor, trying to find someone who is looking at the holistic view of our health is
Yeah.
always important. And it was just a blessing to be able to have that. So I'm so glad that you mentioned nutrition, because there's so many things that affect us that we don't know.
Yeah,
It's true.
Yeah.
that is true.
That's good.
I'm glad you actually mentioned that community of friends, because that is important to have friends that will encourage you to go to the doctor, even though they kind of were just like, no, you go first. You be the guinea pig. I'm not going to go. Why don't you
Right,
find out
right.
what they say?
For the
So I
record,
think
that was
that
not, I was not that friend,
I think
okay?
that it's always great to.
No, she was
Okay, you're
not.
not. But I think that is important to have that community. I
Yeah.
want to say directly to the community though, when people are going through things, like you were just talking about, Gianna, as a community, we also have to be responsible. So
Yeah.
if I call Gianna in 3 days and say, hey, I'm having the same things you're having, I would expect for Gianna to say the same thing of, you may want to get checked out. Something similar happened to me.
Mhm.
I
Mm.
was able to just change my nutrition and soy. Maybe that might be for you, maybe not. Go check
Mm-hmm.
it out. Okay. So
Yeah.
Yeah,
because sometimes I have seen
Absolutely.
that community can work in positive ways and in negative ways, where you just say, well, my friend did X and I did, but I got cancer. Well, because you had the
Right.
same symptoms, but
yeah,
a different pathology. So
Yeah.
I
yeah.
think as a community, we always have to be mindful to give that support to each other as sisters, to tell our story, because I think that's wonderful. But at the same time, to say, now my story may be different. So
Mm-hmm.
Yeah.
check to see if we have the same story first before you throw
Mhm.
that soy milk out.
Yeah.
You know?
Yeah.
Exactly.
That's good. Gianna
Yeah.
always makes that disclaimer, in our group when, people say, hey, this worked for me. Gianna say, just because it worked for this
Oh, I
person,
know she does.
don't mean check with your doctor.
Yes,
But no,
Please.
that's good. That's good.
Oh, I
Because
know
you
she does
you
it.
just may go off of somebody
Yeah.
else and not even go get checked out or
That's
see
true.
your doctor. So that's good.
absolutely.
Yeah.
Okay, we got a couple comments here. People are talking about the soy. Don't throw it out yet. Don't throw it out. That was just my story. Somebody's
Yeah.
mentioning, speaking of non-traditional care, what do you think of herbal supplements when it comes to our health? And I just want to throw this out there too, because so many times when we have issues, for me, like I said at the beginning, I was having repeated loss. And I remember when they finally got to
Mhm.
the bottom of it and found out that I had a blood clotting disorder, they told me, listen, this is something we can fix. You just have to take blood thinners every day. You take these injections in your stomach. It'll keep your blood thin. You'll be fine. You'll have a child. So I'm like, well, praise God. So they put me on Lovenox and heparin and all of that. And at this point, you do your research on it. But at this
Mhm.
point, we're just trying to have a healthy baby. And because it's worked for other people, praise God. But I
Mhm.
remember some people come to me like, you shouldn't be taking that poison. You can take garlic and herbs and that'll keep your blood thin. And I'm like, that's great, but I think we're talking about another life in here, and because we can't determine dosage and
Yeah.
all of that, like I'm not trying to gamble with this thing. Like I need something that's tried and true and measured and all of that, and we can take those other things on top of that, possibly. I don't know, but I just think we have to be careful when we're like, just
We
do
do.
herbs, or because a lot of people were telling me to drink different teas and stuff, and then the doctor was like, no, that will open up your cervix, that causes contractions, and I was like, oh my goodness. So there's so many things and myths and stuff out there, and we want to be informed. So what do you think about herbal supplements?
Mercy.
I think you hit the nail right on the head, Gianna. Anytime you are taking something that is supposed to, claims to help heal or claims to help, relieve whatever, it should always be run by your medical professional. Always. Whether it's herbal supplements or, any other specific instrument used to help. We just don't have the same type of information. Google is great, but when it comes to medications and supplements, sometimes you can be on a medication that's based off of a herbal supplement, and you take that herbal supplement and now you have overdosed yourself because you're on the medicine and the supplement, So it's very important to run a list always by your medical professional, because they're going to have the specific training and knowledge. They know what those things are made of. They know what the medications are made of, and they can give you their professional opinion about what you should take. And if you are super duper like, I need to take herbal medicine, herbal supplements, go to someone who is trained
Yes.
for
Yeah.
herbal supplements. You know what I'm saying? I'm not saying you absolutely have to subscribe to the Western, perception of medical care. You may not want to do that, and that's okay. That is your choice. But still, go to someone who is specifically trained in herbal supplements and holistic medicine. Okay, that's it.
That's good.
Period.
Period.
That's good.
Did you want to say anything?
I have to be transparent in this. Yeah, I have to be transparent. I'm an allopathic, what they consider allopathic trained physician. So I do what would be considered traditional medicine here. You have a headache, take a Tylenol. I will give you something that most likely can be found in Walgreens or CVS. Do I believe in herbal supplements? I do. As a allopathic physician, or what everybody I guess would consider a medical doctor trained in traditional care, we actually are trained that herbal supplements are there. We are trained that they're not necessarily regulated by the FDA, and you need to find out if your patient is on it. And that's about it. And if there's any question or concern, then a lot of physicians will just say, well, just don't take it at all because it could have an adverse effect. So I agree with Dr. Kwani. Definitely going to someone who knows about herbalists, an osteopathic, a naturopathic doc. Now, that being said, I think where we sometimes will run into difficulty or challenges is we feel like we have to choose a team.
Correct.
So I have to choose to do traditional medicine, or I have to choose to go to an herbalist. I have to choose to go to a naturopathic doctor. And that doesn't necessarily have to happen. I know in my practice, I had doulas, I had midwives, I had a compounding pharmacist and herbalist that I would refer patients to, because I think holistically we can all work together. So there were times when the herbalist would say, okay, I'm going to give her this. And I'm like, okay, well, I need to reduce this dose here.
That's good.
So I think it's important as patients to recognize you have that option, but you don't have to choose sides. If you want to take echinacea, then you can right after you take your Tylenol. Like, you don't have to choose. Quite frankly, personally, that's what I do. I do both.
That's good.
Depending on what. So just, and finding a provider that is okay with you wanting to incorporate everything. And they're out there. That's just important to know you don't have to choose sides.
That's right.
That's good. I'm glad you said that, because sometimes people feel like they got to choose.
Right.
That's true.
Is it ever okay to ask for? Is it ever okay to ask for the results? Like, say for instance, you get a bunch of blood work done, and they're trying to find out what may be causing your issue, whatever that may be, and they come back and say, everything came back great, your numbers were good. Is it ever okay to ask the doc, can I get a copy of those results?
Well, I'm not sure about
is your results.
Yeah.
Is your chart. Yes. Yes, always, yes. And there actually are docs, nurse practitioners, offices that will automatically give it to you.
Yeah.
Most recently, when we
Mhm.
went into the electric health records,
Yeah.
they have patient portals where you
Mhm.
can log in and you can
You
see
can see,
all of your
yeah.
results. You can print them off whatever you want. You can print off the after visit summary. And I would recommend that everybody ask. You go to your
Mhm.
doc when you're checking out, paying your copay, setting in your appointment, say, by the way, where's my after visit summary? Or how do
Mhm.
I log in into the patient portal to
Mm.
get my information? Or
Yeah.
Oh, that's
when are you
good.
going to mail me or email me my information? So it's
Yeah.
always important. And let me take it a little step
Mhm.
further, because sometimes those results will get to you and you're looking at them and you don't know what they mean. So it's
Mhm.
important for them to say everything is fine. And you say, okay,
What is
well,
fine?
what is this HEMOGLOBIN? What does that
Yeah.
mean? And why is it 1 point off? But you're saying that it's okay. It is completely fine to have those discussions.
Yes.
You may not always have them with your doc. Sometimes I'll have the nurse get on there. But yeah, that's a part of self-advocacy.
That's
That's right.
good.
Mm. When do
Yeah.
you know? Oh, go ahead, Kwani.
No, no, no. I was gonna say the same thing. The now with electric on the electric medical
Mhm.
record, it's all in a portal now.
Yeah.
So you don't
Mm.
sometimes you don't even have to ask.
You
It'll
don't.
be there before you get home. So
Mhm.
Mm.
yeah.
I love
Hmm.
that.
Yeah.
Okay. Dr. Gina, just especially for our women who are in that space of, the fertility, reproductive years, when do they know, or when do you recommend that a woman should go ahead and go see either a high risk doctor or a fertility specialist? Because we've had so many women who have had two, three, four miscarriages who are still seeing, an OB in. And a lot of times I'm like, man, have you been to a high risk? And they're like, well, no, we haven't been referred there. But then they're looked at crazy when they're having symptoms or having fears surrounding their pregnancy, which is understandable. If you've lost four babies and you're one day not feeling the baby kick, and you're going in and saying, can I get an ultrasound? And they're looking at you like,
Hmm.
no, stop tripping.
Mhm.
It's like, wait a minute, when do we get to that point? When do you recommend? And Kwani, jump in on this too. When do you all think that, okay, after, a certain loss or at a certain age, or what are like those factors that we need to know? Okay, maybe I need to go beyond, the general practitioner and maybe see a specialist.
Yeah, so by definition, and hopefully I get these numbers right, but by definition, when you're talking about a person who's unable to get pregnant, usually before the age of 35, if they aren't able to get pregnant after a year of having no success, then they can request or choose to go to reproductive endocrinology at that point, infertility specialists at that point. I do have to say that there are a lot of OBGYNs that know basics with fertility, but less than 35, you've not been able to get pregnant on your own, then that you need to have that conversation. Over 35, I would say, within 6 months. Now, when you're talking about a person who's had loss, significant loss, by definition, it's usually after two losses,
Hmm.
you're considered more high risk. So you
Okay.
can have that discussion with your OBGYN that if you get pregnant again, you want to have that consultation with a high risk physician or a perinatalogist. And a lot of places automatically they'll, after two losses, they're like, hey, you're going to a high risk doc.
Yeah.
Once you have gotten pregnant. Prior to getting pregnant, though, those are conversations that you really need to have if you've had a lot of losses and say, okay, what do we need to do differently? There are some perinatologists that will do preconception appointments. Since they deal with women that are pregnant, a lot of times they'll have you to do that with your general OB. But there are some high risk doctors that will see you. They'll let you talk to a genetic specialist, that type of thing. But usually after two losses, definitely you need to see somebody. And honestly, if you you have medical issues, if you have high blood pressure, if you have thyroid disease, if you have seizures, if you have diabetes, that puts you at a different level of risk. And those are conversations that you need to have with your provider before you get pregnant. And if you get pregnant immediately, those are conversations you need to see them to talk about.
That's
Dr.
good.
Kwani, did you want to weigh in on that?
She covered it all.
Oh, man,
Kwani just
I
leaving
love
me
it.
out here by myself.
Listen, ma'am. Look, I got you with the research. Look, I can't help with the medical stuff now. I'm gonna stay in my lane.
Somebody said, why is it that OBs won't even refer you then? I mean, at that point, I guess you have to start doing your own research. Is that what are they saying that
No.
even after they
So-
see the losses or see the problems, they don't refer? Is that what she meant?
If that's what they mean, then it sounds like they need a new OB.
Or, I mean, let's call a thing a thing.
I don't know.
Check
how
your
else to
insurance.
say that.
Check your what?
Check your insurance.
Your insurance.
If you pay the big bucks to go to whomever you want to go to, then there are people who pay premiums so that they do not need referrals. So it could be, like Dr. Gina said, it could be a doctor issue and it could be an insurance issue. Just definitely check it out.
That's good. Somebody said, Dr. Gina, we need you in Huntsville.
I think I would need more information on that particular person's question.
Yeah.
You said what?
Yeah. Somebody said, Dr. Gina, we need you in Huntsville. They said they felt like I've been to an OBGYN visit, but a more comfortable one.
Oh,
I
man.
love that.
That's so sweet. That's sweet.
Yes, this has been so good. So before we close out, ladies, what would you just admonish to any listener? A teenager, whether they're a grandmother, what is the one thing you want them to take away from this conversation? And we'll just go around. We'll start with you, Dr. Ard.
Gosh, the one thing that I want women listening to this to know is that you matter. Your body matters. Your health matters. And if you are not receiving what you need, say something.
Yeah.
Don't wait. Don't settle. Don't second guess it. Ask for what you need and keep asking until you receive it, because literally your life depends on it.
Yeah, that's good.
Oh, that's good.
Ask all the questions.
Yeah. Yeah. Sherelle?
Oh, man. Just to piggyback off of that is really just to speak up and to not be afraid. From speaking from someone who didn't know that was even an option. Like, I'm telling you now, it's an option. You can speak up. You can ask all the questions. You can go in with your notepad. Like, do all of that. Do everything you need to do to make sure that you receive the best health care possible.
Love
Agreed.
that.
Agreed.
Dr. Gina, talk to us.
Ooh, can I just say ditto and be done?
No.
So I have a gift of gab when it comes to this, because I feel so. Every patient for me was like a family member. Everybody, when they talk about health, they're like a family member. So there's so much I want to tell them. I think the one thing I would probably want is to give them hope, because I know right now you're looking at social media, you're looking at the internet, you're seeing Black mamas dying, women of color, you're seeing all the health disparities, you're seeing so many people of color that are dying of COVID. And it can be scary, it can be disheartening. It can make you not want to go to a healthcare provider. I think that hope, and specifically in the maternal health piece, I want to say that it's going to get better. And why would I say that? Overall, maternity deaths worldwide are decreasing. And California found the way to decrease maternal deaths. They're in this silo of they got it right. And there are states that are adopting new practices to decrease it. They have heard our voices. I know all of us want it to go faster, but I don't want you to think that you're alone. So self-advocacy is important. Know that there are individual advocates. So your doulas, your hospital healthcare advocates, those nurses, your family members, your friends, they're there. There is system advocacy. There are state organizations. There are different organizations that are trying to change policies and laws. So just remain hopeful. Know that every time you go into the office, you may not be that person that's going to have an adverse event. You actually may have a good experience.
That's right.
And just remain hopeful. I think that's the only thing the one thing, since you relegated me to one, only thing I can leave tonight.
Listen, we're here for all of whatever nuggets you got to share. Like somebody said, no copay tonight, so pour it all out. No, I'm just like,
no copay.
Somebody said they're taking all the notes tonight. I just want to say, and I think I kind of mentioned it before, and I think even in our group of ladies in Psalm 113:9 and They That Wait, we have kind of learned to hold each other accountable, like you said, and be each other's advocates. Because like you said, we're so busy taking care of our children, taking care of our husbands, taking care of our jobs, or just pouring into all the things that we have to do, that a lot of times we are so concerned about everybody else. We make sure everybody else goes to the doctor. When we hear a friend complain about something, we're like, girl, go check on that. But I just want to re-encourage us to make sure that we are that friend's advocate, first of all, that we are definitely following up, because I ain't gonna lie, that's half the reason I never go to the doctor, because I have friends and family members who literally will stay on me and text me every week and say, have you been to the doctor yet? What did they say? And I'm like, oh, shoot, about that, because I'm the worst. I am the worst. And so I definitely want to encourage us as women to continue to be that for each other, because we need to be reminded to put on your mask, take care of yourself. So when you hear your friend complaining, saying, I felt something on my breast, or every time I bend over, something ain't right, or girl, are you still feeling pain in your spine from your epidural, or whatever it is, because we'll just be talking. We'll be getting our nails done and be like, girl, this week I woke up in a pool of blood. Like, hold up, that's not normal. Wait a minute. Time out, migraines, headaches, things. And we just need to definitely be our sister's keeper in that regard. And make sure that we're staying and following up. And we've been doing that in our group. Somebody randomly mentioned migraines, and we all got in a group chat, and we were like, ma'am, we're going to stay on you until you go see about this, because this is not normal. And so I appreciate that. And of course, with our own self, we need to do it. But I just want to encourage us to continue to be that community for each other. Lastly, before we go, where can people find you? I see Teaching Doctor on here, so we'll go back around one more time. Dr. Gina, where can people find you?
Yeah, I think actually that is one of the easiest places. If you don't already have my personal cell, if you do, just call me like you've been calling. It's fine. But teachingdoctor.com is
Okay.
a space, or right now there's a Facebook page of teachingdoctor.com. I'm
Okay.
the only one that looks at the messages, emails,
Mm.
contact.us@teachingdoctor.com, or you can just go to the website and sign in through that way. And I help as much as I can. Like I said, I'm a patient safety, health literacy advocate. If I could whisper in everyone's ear or be at everyone's visit, I would. I can't, but as
Mm.
many as I could, I will. So feel free to contact me.
Oh, I love that. All
Yay.
right, Sherelle, where can people find you?
She experienced on IG, on Facebook, on YouTube.
All right, great. And Dr. Kwani?
Oh goodness, you can follow me everywhere. So I'm on I'm on Facebook as the PhD Mama with two M's. I'm on Instagram as Kwani Boo, and I am on Twitter as QYRD08. So you can follow me any of those places. Most of the time, I'm the only one with the name Quantrilla. So you have the right one. That's me.
I
Ah.
love that. I love that. And you can follow us. You're already on They That Wait. We started a YouTube page, so we're going to be posting all these videos on YouTube. So if you feel like you need to go back and listen, if you feel like you need to share this conversation with a girlfriend, please do. This is live on YouTube right now. And so you will be able to go to this Tuesday talk under They That Wait Ministries channel. You'll be able to find this video and share it and go back and take notes. Also, for women who are experiencing infertility or experiencing miscarriage or pregnancy loss, we do have a support group. You can inbox us at They That Wait, and we will send you that information and add you to that group. And all of these ladies are a part of that ministry. And so I just love that they were able to come and share and talk and just be candid. We needed this. So I just appreciate this. Somebody said, can we have a Q&A session next? I have questions.
All
Okay,
right.
next time we'll just do your questions. All
Yeah.
right.
Let's do it.
Yeah.
So everybody is requesting a part 2, so we'll definitely do that. We're going to be doing this
Great.
on a regular basis for sure.
Great.
So thank you all. Thank you, ladies. Thank you, Dr.
Yay.
Thank you for
Gina,
having us.
teaching
Thank
doctor. Thank
you.
you, Sherelle. Thank you, Dr. Kwani.
Yay.
I
Thank
appreciate
you.
you guys. And we will be back next Tuesday for another powerful testimony. But we'll be back with this Tuesday talk very soon. So definitely follow us and look out for it. And everybody have a good night.
All
Thank you for
right.
joining us.
Bye,
Bye.
guys.
Bye.
Thanks for having us. Everyone take